Research Spotlight. Predictive value of high-sensitivity C-reactive protein and microalbuminuria for early identification of diabetic nephropathy in type 2 diabetes mellitus. Introduction. Diabetes mellitus is one of the common metabolic disorders affecting almost 6% of the world's population, and prevalence of this chronic metabolic disease is increasing. Adegate et al. 2006. According to World Health Organization, WHO, 180 million people worldwide had diabetes in 2006, and this number is likely to double by 2030. WHO 2006. Diabetic nephropathy is the leading cause of end-stage renal disease, ESRD, worldwide. Nearly 30% of chronic renal failures in India are due to diabetic nephropathy, Agarwal-SC 2000. The earliest clinical evidence of nephropathy is the appearance of low but abnormal levels, 30 to 300 mg per day or 30 to 300 mg, gm, of albumin in the urine, referred to as microalbuminuria, American Diabetes Association 2004. The first clinical sign of renal dysfunction in patients with diabetes is generally microalbuminuria, a sign of endothelial dysfunction that is not necessarily confirmed to kidney, that develops in 2 to 5% of patients per year. As compared with Caucasians, South Asians have a 3-fold greater risk of developing DN and an almost 40-fold greater risk of developing DN, possibly due to a higher prevalence of insulin resistance in the later. Chandy et al. 2006. Chadi et al. 2009. A population-based study in India demonstrated that the prevalence of overt nephropathy was 2.2%, 95% C 1.51 to 2.91, microalbuminuria was 26.9%. Common risk factors for DN and microalbuminuria were duration of diabetes and levels of HbA1c, and systolic blood pressure, SBP, Unnikrishnan et al. 2007, Sultana et al. 2013. DN poses a huge economic burden for developing countries, such as Bangladesh. The Diab Care study in Bangladesh showed that the prevalence of DN among diabetes patients was 8.6% in an urban hospital, and a recent study showed a prevalence of 6.4% in Rajshahi. Kibriya et al. 2000. Latif et al. 2011. The Diab Care Bangladesh 2008 study evaluated the current status of diabetes care in Bangladesh as a continuation of a similar cross-sectional study conducted previously in 1998. Diabetic nephropathy, DN, is a progressive kidney disease caused by angiopathy of capillaries in glomeruli secondary to long-standing diabetes and is the major cause of morbidity and mortality in patients with type 2 diabetes mellitus, DM. Kibriya et al. 2000. Latif et al. 2011. This emphasizes the importance of interventions that help patients with type 2 diabetes to reduce the risk of nephropathy. Rupakula et al. 2012. Previous studies have proved that type 2 German marks is frequently associated with chronic inflammatory state. Chronic inflammation plays an important role in the development and progression of late complications of diabetes. Thomas 2010. C-reactive protein, CRP, an acute phase reactant, is a highly sensitive marker of inflammation. Its level rises dramatically during inflammatory processes. CRP has a long half-life, affordability of estimation, and stability of its levels with no circadian variation, and therefore is one of the highly sensitive and best markers of vascular inflammation. Navarro et al. 2003. CRP is an acute phase reactant belonging to the pentraxin family. It is almost exclusively produced in the hepatocyles under the control of cytokines. Taylor et al. 1990. The major functions of CRP include binding to various ligands on damaged tissue followed by propagation of both anti- and pro-inflammatory effects. Pepys et al. 2003, Black et al. 2004, Sun et al. 2005. An early sign of impending nephropathy is microalbuminuria, which is defined as an excretion of albumin in the urine, amount ranging from 30 to 300 mg per day or 20 to 200 mg per liter or of 300 to 300 mg, gm in spot urine. American Diabetes Association 2004, De Boer et al. 2007. It begins insidiously and may precede the diagnosis of type 2 German marks. Karamori et al. 2000. It is at this stage that one can hope to DN cannot be cured, but the progression from the stage of incipient nephropathy to the stage of chronic kidney disease can be slowed down. Willems 2005. Quantitative estimation of urine albumin-creatinine ratio, ACR, as a diagnostic measurement for microalbuminuria in diabetic nephropathy. Kong et al. 2005. And inflammatory parameter hs-CRP in patient with type 2 German marks at an early stage of nephropathy are independently associated with urinary albumin excretion, Abrahamian et al. 2007. Relationship between low-grade inflammation and diabetic nephropathy arc still unclear, Chowdhury et al. 2008. Hence the aim of this study is to determine the serum level of high-sensitivity C-reactive protein, hs-CRP, in type 2 diabetic patients with microalbuminuria and to compare with diabetic patients with normalbuminuria, so that level of hs-CRP can be determined as an early predictor of progression of diabetic nephropathy along with microalbuminuria. Rationale of the research. Diabetes mellitus is a major emerging clinical health problem in the 21st century. Incidence of type 2 diabetes is enhancing globally and has reached wide-ranging proportions in many countries. The recent evaluation by the International Diabetes Federation, IDF, revealed the number of people affected by the diabetes mellitus was 382 million, which is predicted to increase to 592 million by 2035. IDF also estimated that about 8.3% of world population and 65.1 million of adult people in India are affected by diabetes, Warigwada et al., 2013. A large body of data showed that the prevalence of type 2 diabetes varies considerably between urban and rural populations and reveal the prevalence of diabetes has increased to 18.6% in urban and 9.2% in rural population in India with significant regional variations, Jaywardena et al. 2012. Approximately 20 to 30% of diabetic patients develop diabetic nephropathy, DN, Saw et al., 2017. Diabetic nephropathy is a progressive kidney disease caused by angiopathy of capillaries in the kidney glomeruli. It is characterized by nephrotic syndrome and diffuse glomerulosclerosis. It is due to long-standing diabetes mellitus and is a prime indication for dialysis. DN is exacerbated by poor glycemic control. Primary symptom of nephropathy is seen in the form of microalbuminuria. DN cannot be cured, but the progression from the stage of incipient nephropathy to the stage of chronic kidney disease can be slowed down. Elevated serum hs-CRP associated with urinary along with microalbuminuria in type 2 German marks patients, suggesting the risk factors for the development of progression from incipient diabetic nephropathy to overt proteinuria and finally ESRD. Thus, regular screening of serum hs-CRP in diabetic patients with microalbuminuria helpful in risk prediction of diabetic nephropathy and early intervention to prevent complication. The study will signify an increasing trend of measuring serum hs-CRP in patient with type 2 German marks and serum hs-CRP associated with the degree of microalbumin excretion and the severity of nephropathy. It's a cheap, minimally invasive, and quantitative in nature that's useful attributes not only in clinical research but also possibly in routine patient care for early assessment of diabetic nephropathy. Research question. Is there any association of serum high-sensitivity C-reactive protein, hs-CRP, levels with R-microalbuminuria as an early predictor of diabetic nephropathy in type 2 diabetic patients? Is regular screening of serum high-sensitivity C-reactive protein, hs-CRP, levels in diabetic patients helpful in risk prediction and diagnosis early stages of diabetic nephropathy for early intervention to prevent progression and complications? Objective. General objectives. To find out the association of serum high-sensitivity C-reactive, hs-CRP, levels with microalbuminuria as an early predictor of diabetic nephropathy in type 2 diabetic patients. Specific objectives. Using the measurement of serum high-sensitivity C-reactive protein, hs-CRP, levels along with microalbuminuria as a screening method for early prediction of development and progression of diabetic nephropathy in type 2 diabetic patients. Review of literature. Several studies have demonstrated a significant association between elevated high-sensitivity C-reactive protein, hs-CRP, levels and microalbuminuria in patients with type 2 diabetes mellitus, highlighting the role of inflammation in the early development of diabetic nephropathy. Mohahidi et al. 2009, reported that diabetic patients with microalbuminuria had significantly higher hs-CRP levels compared to those without, with a positive correlation between hs-CRP and urinary albumin. Similar findings were observed by Likatesh et al. 2017, who noted markedly elevated hs-CRP among diabetic patients with microalbuminuria compared to controls. Liao et al. 2004, found that hs-CRP was highest in diabetic nephropathy patients, and elevated baseline hs-CRP predicted future development of nephropathy. Shahir et al. 2017 also showed that hs-CRP increased with the severity of nephropathy and was associated with metabolic and cardiovascular risk markers. Bashir et al. 2014 and Archana et al. 2015 further supported the significant association between raised CRP and microalbuminuria. A large Japanese cohort study by Hayashino et al. 2014 confirmed that higher hs-CRP independently predicted the development of microalbuminuria. Poskic et al. 2018 demonstrated significantly higher hs-CRP in patients with microalbuminuria and found hs-CRP to be an independent predictor of its occurrence. Wahid et al. 2016 also showed increasing CRP levels with worsening albuminuria. Other studies, including those by Rupakula et al. 2002 and Saw et al. 2015, highlighted positive associations between hs-CRP, renal function markers, and glycemic control, reinforcing the importance of hs-CRP as an early inflammatory marker in diabetic nephropathy. Materials and methods, study design, cross-sectional comparative study, study setting, indoor and outpatient departments of endocrinology and nephrology, Medical College Hospital. Study period, January 2018 to December 2018. Study population, type 2 diabetic patients aged 30 to 60 years attending MMCH who met inclusion criteria and provided informed consent. Age and sex-matched controls were included. Sample size, required sample, 245, but due to time, logistics, and resource constraints, final sample size was fixed at 100. Sampling technique, purposive non-probability sampling. Inclusion criteria, confirmed type 2 diabetes, age 30 to 60 years. Exclusion criteria, diabetes other than type 2. Overt proteinuria, greater than 300 mg on dipstick, uncontrolled hypertension, greater than 160/110ths of a millimeter of mercury, or ASI, ARB use. Acute illness affecting CRP, conditions altering CRP, RA, malignancy, trauma, dehydration, UTI, etc. Anti-inflammatory drug use, BMI greater than 30. Unwilling participants, variables, socio-demographic, age, sex, occupation, residence, education, income, smoking, weight. Comorbidities, hypertension, CKD, cardiac, liver disease. Biochemical, fasting glucose, HbA1c, serum creatinine, hs-CRP, CBC, urinary ACR. Data collection procedure. Eligible type 2 diabetic patients underwent testing for fasting glucose, HbA1c, creatinine, hs-CRP, and ACR. Study purpose was explained, and written consent obtained. Tools, semi-structured questionnaire and case record form, CRF, after pre-testing. Data collection method, face-to-face interviews and review of clinical records. Data analysis, data processed manually and via SPSS v21. Descriptive statistics were used. Pearson correlation tested the relationship between hs-CRP and microalbuminuria. Ethical considerations, no physical or psychological risk. Institutional Review Board approval, informed consent obtained from all participants. Results, age distribution. A total of 100 participants were included in the study. The highest proportion, 48%, belonged to the 41 to 50 years age group, followed by 34% who were above 50 years. The remaining 18% were between 30 to 40 years. The mean age of the study population was 47.47 plus or minus 7.32 years. Sex distribution. Figure 1 demonstrates the sex distribution of participants, where 51% were female and 49% were male. Occupational status. The most common occupation was housewife, 41%, followed by service holders, 27%, businesspersons, 13%, others, 16%, students, 2%, and day laborers, 1%. Socioeconomic status. Based on monthly household income, 67% of participants were from the middle class group, followed by 22% from the upper class, and 11% from the lower class. BMI status. As presented in Table IV, 82% of subjects had BMI within the normal Asian range, 18.5 to 22.9 kilograms per square meter, 15% were overweight, and only 3% were underweight. Comorbidities 36% were smokers. Hypertension was present in 29% of subjects. No cases of chronic kidney disease, CKD, or chronic liver disease, CLD, were reported. Ischemic heart disease was observed in 2% of participants. Duration of diabetes 42% of patients had diabetes for 6 to 10 years, 35% for more than 10 years, 13% for 2 to 5 years, and 10% were newly diagnosed or had diabetes for less than 1 year. Drug use patterns 59% were on oral antidiabetic drugs, 18% on insulin, 17% on combination therapy, and 6% were not taking any antidiabetic medications. Among hypertensive patients, calcium channel blockers were the most commonly used, 53.3%. Frequency of microalbuminuria 59% of subjects had microalbuminuria, whereas 41% had normal urinary albumin levels. Association of biochemical parameters with microalbuminuria, fasting blood glucose, FBS, HbA1c, and serum creatinine levels were significantly higher in participants with microalbuminuria compared to those without. FBS 8.19 plus or minus 2.83 versus 7.16 plus or minus 1.89 mmol, L. P equals 0.031, HbA1c 7.99 plus or minus 1.85 versus 6.77 plus or minus 1.39, P equals 0.001, serum creatinine 1.13 plus or minus 0.23 versus 1.00 plus or minus 0.26 milligrams per deciliter, P equals 0.016. Figure 2 further shows that mean microalbuminuria was 130.78 plus or minus 77.16 milligrams per gram in the microalbuminuric group and 22.83 plus or minus 5.14 milligrams per gram in the non-microalbuminuric group. Association between hs-CRP and microalbuminuria. hs-CRP levels were significantly higher in subjects with microalbuminuria compared to those without, 5.11 plus or minus 1.41 versus 2.23 plus or minus 0.89, P equals 0.001. This indicates a strong association between systemic inflammation and early renal involvement in type 2 diabetes. Correlation analysis. Significant positive correlations between microalbuminuria and all biochemical parameters. FBS, R equals 0.324, P equals 0.001, HbA1c, R equals 0.489, P equals 0.001, serum creatinine, R equals 0.303, P equals 0.002, hs-CRP, R equals 0.793, P equals 0.001. The strongest correlation was observed between microalbuminuria and hs-CRP. Multiple logistic regression analysis. Multivariate logistic regression results. After adjustment for confounders, HbA1c, serum creatinine, and hs-CRP remain significant independent predictors of microalbuminuria. HbA1c greater than 6.5%. OR equals 3.79. P equals 0.008. Serum creatinine greater than 1 mg per deciliter. OR equals 3.02. P equals 0.010. hs-CRP greater than 3 mg per liter. OR equals 6.78. P equals 0.001. Age and FBS did not show statistically significant associations. Scatter plot of hs-CRP and microalbuminuria. Clear positive relationship between hs-CRP levels and microalbuminuria, indicating that higher inflammatory marker levels correspond to higher urinary albumin excretion. Discussion. Diabetic nephropathy is a major complication of diabetes and a leading cause of end-stage renal disease worldwide. Microalbuminuria is the earliest clinical marker of diabetic kidney damage, and its timely detection is crucial to prevent progression. CRP, an inflammatory marker, has also been linked to poor glycemic control and diabetic complications. In this study, patients with microalbuminuria had significantly higher hs-CRP levels, indicating a strong association between inflammation and early diabetic nephropathy. This is consistent with previous studies showing that elevated CRP correlates with microalbuminuria, reduced renal function, and increased risk of nephropathy. Microalbuminuria showed significant positive correlations with FBS, HbA1c, serum creatinine, and hs-CRP. HbA1c levels were also significantly higher among patients with microalbuminuria, reflecting persistent hyperglycemia as reported in earlier studies. The strong correlation between hs-CRP and microalbuminuria, R equals 0.79, P less than 0.001, supports the role of inflammation in early renal involvement in type 2 diabetes. Multivariate analysis further identified HbA1c, serum creatinine, and hs-CRP as independent predictors of microalbuminuria, while age and FBS showed no significant association. Overall, the findings suggest that elevated hs-CRP may serve as an additional, convenient marker for early detection of diabetic nephropathy. Early screening for both microalbuminuria and hs-CRP could help prevent progression to advanced kidney disease. Conclusion: it is concluded that there is a significant association between the level of serum CRP and microalbuminuria in type 2 diabetics. Thus, activation of inflammatory pathways in progression of kidney disease as represented by high-sensitive CRP suggests that measurement of serum CRP can be useful for diagnosis of early stages of diabetic nephropathy. Further studies are needed to see the role CRP for monitoring the risk of atherosclerotic complications in patients with chronic kidney disease and end-stage renal disease. Serum hs-CRP may be useful for predicting the future risk of developing diabetic nephropathy. Limitation: the sample size of the study was small. The study period was short. The study was carried out in single center. Long-term follow-up was not possible to take. Recommendation: further research is required to observe whether there is a beneficial strategy to reduce the risk of diabetic nephropathy in type 2 diabetic patients with high levels of hs-CRP. From the findings of this study, we recommend to carry out large multicentric prospective study.